Welcome to Health Policy, Organization, and Finance. This is your Week 3 video. This will be a quick video because there's a lot of readings this week as well as some other videos. I put in quite a few websites that I'm looking for you to explore, not necessarily read everything, but just kind of click around, become familiar with who has the website and what they're providing for information. So just a quick review of our first 3 weeks. We have discussed the history of health policy in this country and also financing and payment structures. This week we're going to start to actually dive into policies. We'll do Medicare this week and Medicaid next week. If you have already looked at Medicare in other courses or maybe in different programs, you probably have gone a little bit deeper into Medicare. We're going to look at very broadly at Medicare in week 3. Medicare is a giant set of policies, and we are broadly looking at this, so I don't want you to get caught up in the details of Medicare. There are thousands of little side roads that you could take in Medicare that you could have many discussions about things that are paid for, not paid for, covered, not covered, why we do it this way. So I want to just look broadly at Medicare as a policy this week. What is Medicare? In 1965, Lyndon B. Johnson was president and pushed through Medicare and Medicaid. These two programs originally were thought to give health insurance to folks who could not afford it. It was really the start of the conversations about national health care that continue to this day. One of the interesting things that we'll talk about more is Medicare was based on giving health insurance to an aging population. Medicaid was more about folks that were under certain income limits. However, Medicare ended up over the years covering disabled individuals and some categorical individuals like end-stage renal disease. So the point of Medicare was to cover aging individuals, and Medicaid should theoretically have covered disabled individuals, and that does to some effect, but it has become quite complicated over the years. Medicare now is made up mostly of 4 parts. Part A, which covers hospital insurance. Part B, which is considered medical insurance. Part C, which are Advantage plans, and you'll hear more about those. And Part D, which is prescription drug benefits. Part C was added much later on, and Part D was also added much later on. So these days, we think of Medicare as providing a government health insurance for people who are 65 and older. Or you could meet certain disability requirements. So if you are under the age of 65 and you receive Social Security benefits, maybe because you're disabled, you might also qualify for Medicare. So those of you who work in the field will know sometimes you will run across people who have Medicare who certainly aren't 65 or older. Now, end-stage renal disease is an example of a categorical group that was put under Medicare. There are other groups as well. One of the shocking things about Medicare, I find, is that it doesn't cover everything, right? A lot of people who turn 65 and go on Medicare are actually really surprised to find out a lot of things aren't covered that they expected to be covered. Some examples could include eye and foot care. What about hearing aids? I mean, the most shocking is always long-term or custodial care. So I find that most Americans are really shocked when they learn that they might need a nursing home, but Medicare doesn't actually cover that. So I want to go over a couple of important points. What I want you to know this week is Medicare and Medicaid are very different. as health policy, public health students, you really need to know the distinctions between Medicare and Medicaid. If you don't have that down, start working on that in week 3 and week 4. Keep in mind that these are insurance programs. These are not actual health care. This is very different from government-run health care. If you want to see government-run health care, you could check out like the veterans system, which is a insured system, but also the employees of the system work for government. So that is truly a government-run healthcare model. Medicare is a national health insurance model. I think the easiest way to think of it is Medicare, elderly, aging, Medicaid, income. Obviously, that doesn't always speak to all the groups that could be covered under Medicare or Medicaid because we know it can be confusing. However, that's the easiest way for me to think about it. So, this week as you read through Medicare, think about our initial tools and analyze Medicare. Is Medicare good policy? Think about costs, quality, access. Costs, you will see that the cost of Medicare is astronomical, right? What about quality? Well, we want Medicare to have really great quality, but it comes back to the fact that this is an insurance program. So how much quality can it actually create? You can see in some of the modern changes to Medicare, quality is really, we try to control quality through Medicare, but it's not always that easy. And access. A lot of people think Medicare is available for everyone who's 65 and older. Look really carefully about who is covered under Medicare and who's not. I want you to think about who is currently covered under Medicare and who should be. There's a national conversation about whether we expand Medicare or whether we reduce Medicare. Think about that in terms of access. So this week, you're going to discuss Medicare. I want you to use your analysis tool of access in the discussion board. You're also going to have a 2-page review of your paper topic due this week. I don't want you to freak out about it. You might change your topic throughout the semester. You might modify it. This really is an assignment that is to incentivize you to get started on this process. If you have a topic that you know you're going to be interested in, you can probably dive a little deeper. But if not, what I want you to do really is look at the history of a policy. Where did it come from? Why do we have this policy? And tell me a little bit why you're excited about this. So that's really it for week 3. There's a lot of readings. There's a couple short videos. I want you to explore some websites. There is a discussion post, and don't forget your assignment is due at the end of the week. Have a great week, and as always, contact me if you have questions, comments, or concerns.